part 2 of our analysis of the Vanguard study, planning for healthcare costs and retirement. So the first part of this, and go back and see the video if you would just talk about annual healthcare costs for like premiums of Medicare Part B, your Medigap, Medicare Advantage, whatnot, and whatever your OOP, out-of-pocket expenses are. Now we're going to dive into long-term care because they should be two completely separate, unique line items on your budgeting. And Vanguard does a good study on this as well, on the study. Long-term care costs of retirement. Long-term care presents a far different type of retirement planning challenge than annual healthcare costs. They are unpredictable, sometimes large, sometimes zero, and rarely covered by health insurance other than long-term care insurance policies, which are exceedingly difficult to obtain or afford. Now, this is huge right here, my friends. The total amount someone might pay for long-term care represents a combination of whether the person, A, will need care, and if so, what type and for how long. About half the elderly can expect no cost for long-term care. Another quarter can expect a cost of less than $100,000. 15%, though, could expect costs exceeding $250,000 or more. So my first thing is like, that's different because the EBRI study that I talked about not too long ago on a video said that the vast majority of the cost is actually quite low. Very, very, very few people have the cost exceeding $250,000. I mean, it's skewed that if you do, you're in a world of hurt, but the vast majority don't. Not even close to 15%. 15% is still lower than what they'd have you anticipate in the financial industry, which is, again, fear-mongering. But so I wondered, where did they come up with that number? So I did some research to figure out where they're using this. They're using it from here. The Assistant Secretary for Planning and Evaluation, ASPE, the fact that we have that as an own office is scary in of itself. And they talk about the long-term care services and supports needs. They use microsimulation modeling. We estimate that about a half Americans turning 65 today will develop a serious enough injury to require LTSS, long-term care service and support. Although most will need assistance for less than 2 years, about 1 in 7, however, will have a disability for more than 5. And on average, people turning 65 today will incur $138,000 in future long-term care service and support needs. All right, now where did they get in their numbers? I'm wondering. So you might say, yeah, that's interesting. So they, ASPE, let's see. According to projections, right here. According to projections from the CBO, the Congressional Budget Office, due to population growth, long-term care services support expenses, including all formal care, Medicaid, and other private and public resources, could more than double from 1.3 to 3% of GDP. The ASPE research brief presents information about the risk of needing care using a microsimulation model, which is used to describe the future care needs for Americans. This model can predict what percentage of individuals will develop a disability, have long-term care service needs, use paid long-term care service, and among those, how much they paid for it and for how long. It estimates care costs and how they would be financed under current policies. Microsimulation modeling provides not only the average likelihood of these outcomes, but also describes a distribution of these needs as well and the cost. The results of this brief are derived from analysis using the Urban Institute's dynamic microsimulation model, which is designed to analyze retirement aging issues over time. So a couple things there. First, if you ever follow the CBO, it's a crapshoot. Sometimes they're right, sometimes they're wrong. It's no different than a monkey throwing darts at a stock chart. Literally, the CBO numbers are just silly. Secondly, they're using current policies if they're estimating the costs under current policies. So this was written in 2015. The policy's already changed since then. So we're going to use models based on that under the current policies, which is what their models are based on. It's crazy. Thirdly, microsimulations are just modeling. I'm literally modeling. If you think modeling is all that, a bag of chips, just look at long-term capital management for sure. LTCM from 1998, 1999, and tell me that models, in fact, I got a book right here. Models Behaving Badly, in fact, is what I got to read from Emmanuel Derman, author of My Life as a Quant, Reflections on Physics and Finance. So Models Behaving Badly is my next book to read. I can't wait because modeling is just model. The irony of it all is we have studies from EBRI, Employee Benefit Research Institute, which they did actual studies, not just modeling, but actual results from people saying what their actual costs were. And while the model that we're using here, SPE, which is what Vanguard's using in their brief here, is still pretty good in terms of showing that the vast majority of us are not going to have huge expenses for long-term care. Even this number is kind of high relative to what the EBRI showed. So again, I don't make light of it, but I'll show you something I think you'll find it interesting. Long-term care services help individuals with with the 6 activities of daily living: bathing, dressing, toileting, transferring, getting out of bed, incontinence, and eating. So transferring is getting out of bed or getting off your chair and pivoting. My friend Jamie said her mom, she had to get tested for pivoting for ADL. All right, so I want to show you this right here. Let's see. Examples include assistance with ADLs are often associated with cognitive decline, dementia, Alzheimer's, permanent disability, and other chronic conditions. The most common stroke situation would be stroke, Parkinson's, osteoarthritis, are also common needs for long-term care. All right. Once begun, ongoing long-term care is generally consumed for the rest of the person's life. So here we go. This is a fat tail, if you will, not a true fat tail, but 48% of retirees can expect no cost. All right. 15% of retirees can expect a cost of over $250,000. So if you're here, we got 5, 11, 15, 21 plus 48, was that 21 plus 48 plus 48? So 69% of the people will spend less than $75,000. That's in total, not annual, that's total. All right, so again, we're going to get worried about this right here, okay, when this right here is a huge, significant portion of the population. And remember, just like we talked about the other episodes, based on a lot of things, your location, because this right here is just all inclusive. What's $250,000 for someone in San Francisco? It ain't the same in Birmingham, Alabama, but it's all inclusive. So you got to look at your location. You got to look at your own situation, your personal family dynamic, and your own health. Now, lastly, what does this tell you right here? Well, likelihood of it happening is nil. If it does happen, it could be pretty catastrophic. That's where insurance comes in. I mean, this is perfect right here is a video or the graph you need for insurance. You say likelihood of me being hit by a bus and dying as a 48-year-old man who doesn't smoke or not even getting hit by a bus. The likelihood of me dying is minimal. But if it happens, it's catastrophic to my heirs. So I better get insurance to cover that unlikelihood of it happening. And so, but you don't get it insurance when you are one of these 15%. You get it when you're down here, not likely to be part of it because it's cheaper and you can afford it and you can get approved. So just get a long-term care policy for the love of Mary. It's not going to be that expensive. I was talking to a guy the other day. He's in his 40s. Like, I'll wait till I'm in my 50s. I said, no. He goes, well, Dave Ramsey says, you don't wait till you're in your 50s. Get it now. Get it now. Again, the point about insurance, any kind of insurance, is to protect you against a fat tail risk. And so the fat tail risk is still here if you're 45 or if you're 55. So get it now to protect against it. Let's keep going down here. Several types of long-term care services. We talk about in-home health, talk about that a lot, so I'm not going to talk about here. In-home care, adult daycare, assisted living, and then nursing home, and then obviously continuing care retirement communities. They talk about, I'm just not going to get into that. All right, costs vary by region. Let's talk about the region where the costs are here. This is the cost for the various, different things: adult daycare, assisted living, homemaker services, blah blah blah, by region. And you can see here the highest is in Alaska. What's that? That's Pennsylvania. That's Pennsylvania right there. That's Massachusetts. No, that's Connecticut. So basically, always in the Northeast. Massachusetts, Connecticut, pretty high, which is odd because lots of insurance companies there. The New York area is pretty high. Whatever this is right here, middle of Oregon. Don't know up here in, I guess that's North Dakota. It's probably Detroit, Erie. So anyway, you can see where the costs are highest, pretty much throughout the Northeast, Florida, and the West Coast. The lowest are in Texas, Oklahoma, Missouri, Arkansas, Louisiana, up through Illinois. Actually, that's pretty cool. Let's keep going down here. Lots of good charts on this thing. I'm glad Vanguard did this. All right, about half of individuals will need some kind of long-term care. All right, so 58% of men will not. Simply in the use of long-term care. Now, did they talk about if your wife provides the use of long-term care? I'm not sure. But about half of all people will not use any type of long-term care. 58% of men won't. So the majority of men won't. I presume that's because their wives are taking care of them, but probably because they die early. All right, that's probably why. Their wives probably don't even take care of them because they die too soon. project use of long-term care. And then 8% of women will have adults require at least 2 years of paid care. So 8%, this is their projections, by the way. This is not factual. This is just their projections, but I bet there's some legitimacy to that. 8% of women will need long-term care for at least 2 years. 11% of women, at least 5 years, 11% of women will need it for between 2 and 5 years. So 50% of women roughly don't need it all. 23% of it need it for less than a year. Another 10%. So basically 35, about 85% of the people of women will need long-term care for 2 years or less. Again, buy a long-term care insurance policy and you are covered. Duration means a big deal too. And I want to show you this other chart. Yeah, right here. So out-of-pocket expenses is right here. So basically, majority of long-term care costs are paid for out-of-pocket. Medicare does pay some, again, but you got to remember the difference between long-term care versus caring versus curing. If it's caring, Medicare won't pay. If it's curing, where you get better Medicare would. Medicaid does pay for caring and curing, but mostly it's out-of-pocket expense. And of those out-of-pocket expense, 53, or if you have an insurance policy, but 53% of those are out of pocket of that. All right, let's keep going down here. How should retirees plan for long-term care? Financial assets is the biggest, your biggest source of long-term care funding is a private out-of-pocket spending. Again, get a long-term care policy. Go roll the home, reverse mortgages. I've talked about that a million times on Sunday, and the long-term care insurance for sure. Let's see if there's anything else I wanted to talk about here. I do challenge in some regard that 15% of the population will spend $250,000 or more. But hey, even if that were true, the way you protect yourself against that is by buying a long-term care. So insurance policy. At the end of the day, I think this episode will show you the need for long-term care insurance. I absolutely do. I'm a big fan of it for sure. However you buy it is a life insurance policy with a rider that has long-term care. It's called accelerated death benefit. We have access to it for long-term care needs. You buy a straight long-term care insurance policy, which is what I have. You can do however you want to do it. Just do it. Get a long-term care. Don't wait till your 50s. Like Dave Ramsey says, do it right now. You'll never have it cheaper than right now because you're younger than you'll ever be. And most likely you're in the best shape of your life, regardless of what that is. Now, if you are going to get in better shape by quit smoking and stuff, then wait. But if for the time being, if that's not feasible, then buy the long-term care. At the end of the day, the whole point of this study is that the more people are worried about health care expenses, retirement, than they are worried about running out of money. And inherently, that's not a rational perspective because you can run out of money without having to pay any health care costs. You can't run out of money with health. So one can happen without the other happening, but we're more worried about the one happening than the other. It doesn't make sense, but that's the way it is. The media has been telling us this for a long time about running out of money. We're all going to run out of money for healthcare costs. It's just not likely to happen. It's not likely to happen. So stop worrying. Take action, buy insurance policies, get your supplemental policies if you're going on Medicare if you can. And that's the best stuff you can do. And then just pray that you don't get sick. Big time, because if it happens, it doesn't happen frequently. If it does, that stinks. But the vast majority of us, it won't. That's just all there is to it. So if you like what you see here, don't forget to subscribe down below, my friends. Let me know. Questions, comments, concerns, always welcome. Thumbs up always help me. And go to the blog at heritagewealthplanning.com. We'll see you next time.